Record. Okay. Is everybody okay with me recording so that Andrea can be a part of it? She had a conflict. Great.
Of course. I'm just going to turn my video off so that you don't have to watch me eat food on a recording.
Sounds great. Okay, so we sent out these minutes. We did not get any feedback on any suggested edits or changes. We welcomed Sang and Bobby to the committee last month, and Bobby wasn't able to join us. Sang was there, but so welcome, Bobby. This is his first meeting as part of the MHSA steering committee. We're very excited to have both of you.
Thank you.
We reviewed our community input subcommittee updates, and so this subcommittee has been very instrumental in providing feedback and information on the community input process that we're currently going through. We also had a report from our innovation subcommittee where we discussed the CARE project, their change request, and their quality assurance review. So I'll provide an update on that later. This subcommittee, we've been challenged with our schedules lately, and we're hoping that we can meet sometime in the near future. And then suggested topics for the next meeting was we could look at the MHSA 101 presentation, which I'm happy to do that, but it is a 10-minute video. And so I'm not sure if that's the best use of our time together, or if I could just send you the link that you can watch it at your own pace. I'm going to report out on how the initial community input meetings are going. And then we talked about policy updates as it relates to MHSA. And you could see that our agenda doesn't reflect that today because we have special guest Danelle Campbell, who is the program manager over our prevention unit, who is going to be introducing us to physician committed and a potential expansion of that program. So without further ado, I'm going to move down to chair and vice chair update. So Mary, in January, the floor is yours. Do you have any updates you would like to provide?
I was unable to attend the Behavioral Health Board meeting January. Were you able to report at that meeting?
No, I was not, and I emailed back, and Holly said that she would cover it.
Okay, fine. I just didn't know if there was anything significant that we needed to report on that. At this point, we do have an application for membership. Well, actually, we have two. One just has the name and the contact number. So I'm asking Rocio, maybe you can get a hold of that person and ask them if they would be more forthcoming with answering the rest of the questions. And then the second one is from Anna Bauer, who many of you might know her from the First Five Commission. And she's very interested in becoming a committee member. I have worked with her in the past and would definitely be happy to include her in our committee. Do we need to have, what's the procedure, Holly, on voting someone in? Do we just need a majority or?
Yep, it's just at your discretion, the chair and the vice chair. If you want to include the committee, you're more than welcome to, but you guys are the final say.
Okay.
You may ask for an interview if you feel like that would be helpful and understand, but it sounds like you already know Anna, so.
Yeah, well, I mean, I know personally, I don't know if anybody else has anything else they want to say about it, or if they're ready to take a vote now. If they would rather wait and have us share the application with you, then we could go ahead and vote at the next meeting. So what seems to be the pleasure of the group? Well, okay, let's go ahead and vote.
So Mary, you're saying either vote now or wait till next meeting, right?
Right. Yeah, so who would prefer to vote now?
I'm in favor of voting now.
Yeah, I don't see a reason to not vote now.
And we had talked a little bit about this last time, I think. We talked about Anna.
Yeah. Yeah. Okay, so let's go ahead and do that. All those in favor of asking Anna Bauer to join our committee, please say aye.
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 All those opposed? Okay, great. Then we'll go ahead and send out our invitation to Anna. I think she'll be a really good addition to this committee. We have been really busy working with Holly on the surveys that you all have seen out and about. And I know that she has worked really hard getting the video 101 up and going. And I think that she will probably give us more of an update on how those meetings are going. Other than that, I don't really have anything else. January, you have anything you want to report?
I don't.
Perfect.
Okay, I'll hand it back to Holly.
Okay, thank you both. So I had mentioned that I would move my community input update a little bit lower on the agenda since we do have a special guest today to talk a little bit about physician committed. And so I am going to share a draft document that really Danelle and I have started putting together just this week. And it's a potential proposal to expand physician committed. And the reason being is what Danelle is going to be talking about, but just to give you guys some context, this program with the approval authority that was granted on May 25th, 2018 was for 3 years, and that began on July 1st of 2018. So the third fiscal year would be concluding this June 30th, 2021. And so we have this draft of a potential change request that just started to really be discussed this week, as I mentioned. With that, Danelle, are you comfortable speaking about to the program a little bit and answering any questions? Oh wait, is my screen showing for the document?
Mm-hmm.
Okay.
Yes.
Okay. Okay, great.
Absolutely. So, Holly, does this group have some familiarity with physicians committed already, or should I start from?
I think some context and history just would be helpful. They know of it, but not as well as you.
Sure. Okay. So, this program actually started as a pilot initiative 5 years ago when Butte Medical Society, some physicians who were part of the Butte Medical Society, their children were actually athletes at Chico Unified and had experienced the athlete committed program, and the doctors felt like there was a role for them in that initiative. And really what they wanted to do was expand the physical health screenings that happened on an annual basis that many of them volunteered to do, to include mental health and substance use screening as well. So we dove into the research and found models that had already been validated and researched and tested, and landed on what you probably now have seen as the Physicians Committed Behavioral Health Screening. In our initial pilot years prior to the approval from the MHSA commissioners, the screening only happened during the athletic physicals at Chico Unified School District. With the approval from the commissioners to expand the model, we looked at it in terms of phases, and those phases included moving into other school districts and using their athletic physicals as a natural convening where we could screen a significant number of high school students. And right when we were about to do that, the campfire happened. And what we discovered in our very next screening, which happened to be out in Oroville, our numbers just flew off the charts. The need was far greater than what it had been prior to the campfire. And we experienced some barriers that made it really hard for young people who were screened and found to need some additional support. They meet with our brief intervention specialists for 3 sessions, and if they're found to need longer term clinical care, we ran into a lot of roadblocks between what was supposed to be a warm handoff from our brief intervention specialist into counseling services. And those roadblocks and those barriers meant that some of those young people actually did not ever land in long-term clinical care. It included things like they maybe had private insurance, but the copay was too much and the parents were not supportive of them getting the clinical care. Maybe they were possibly eligible for Medi-Cal, but for whatever reason, the family was choosing to not kind of be on the radar. They wanted to stay out of the system. For some of these young people, the family dynamics were really what the significant issue was, and they really didn't want involvement from their parents because of that. So we actually were able to go back to the commissioners with an expansion of our initiative that increased the brief intervention specialist team and added a clinical navigator. And that clinical navigator's role is to provide that clinical support to that young person while they find that next best level of care so that we don't lose those kiddos in that transition. And then COVID happened, and here we are in the midst of a global pandemic and had to pivot again. Oh, I forgot to mention, we also had an expansion from the athletic physicals into the 10th grade hearing and vision screenings. So we were able to do the behavioral health screening with every 10th grader in Chico Unified who was already being screened for hearing and vision, as well as the athletic physicals. And then COVID hit, and we pivoted again and really started our transition to the primary care clinics and pediatric clinics in the community, because our normal methods for touch points for reaching young people to screen them were just not happening anymore. They did not have the 10th grade hearing and vision screenings because the students weren't physically at school. And the athletic physicals, although they happened, we had a very small number of young people who participated in that screening this year because of COVID. So we transitioned, the team started working with the community providers, and just recently, within the last 1 to 2 months, have engaged Adventist Health up in Paradise, who has just agreed to start using the physicians committed screening with every adolescent who comes through their clinic. Feather River Tribal Health and North Valley Indian Health, as well as some private practices. Most recently, a chiropractor in Chico, as well as some of the private practice clinics in Gridley and Oroville as well. This pivot now into the more physical health setting was really something that was going to happen further down the road, but because of COVID has happened sooner than later. And now what we are imagining we're going to experience is similar to what we saw on the tails of the campfire. And that is a significant increase again, that the need will be quite great as young people start to transition back due to this prolonged isolation and uncertainty and anxiety that's troubling a lot of the young people who have been sheltered at home and don't have their normal support systems in place. So our hope is to be granted the 2-year extension. As students come back to school, we have been talking to Chico Unified and Paradise Unified about some new opportunities to reach more of their students with these screenings. One of which is Chico Unified has asked that we start screening the Fairview High School students. Those students aren't normally playing the traditional sports, and they wouldn't be screened through those other methods. So by expanding into Fairview, that'll give us an opportunity to work with those alternative high school students. And then Paradise has asked that we work with their school district to incorporate the physicians committed screening with their athletic physicals and their 10th grade hearing and vision screenings as well. So,
Oh, it looks like you're breaking up now. I think you're going through a bad spot.
new opportunities in the very near future, as well as those partnerships with the tell us that our numbers are most likely already high. Oh, well, can you hear me now?
You're breaking up.
Can you hear me? Can you hear me?
We can hear you.
Can you hear me now? Oh,
Yeah, I wonder
Can
if
you hear me? You can hear me.
you sound like a robot. Maybe if you, I think her phone dropped the call.
I think we just lost her.
Yeah. Well, Jen, Skinner, did you want to pick up where she was kind of going, or we can just
I can do my best. She
Okay.
is much more acquainted with the expansion process than I am. But just as a quick, oh, are you here? Did she? Oh, there.
I'm back.
There you are. Yeah, we had a whole couple minutes where we could not hear anything you were saying, Danelle. So
Don't know how stable it is, but what that point.
Oh no. Poor thing.
Mhm.
Okay, so I'll try and help a little bit and see if we can get her back.
Well, I think she was winding down anyways.
So currently our as she mentioned, you know, our screening process happens with student athletes when they come in for their athletic physicals. But the screening process is also being adopted by several physicians across the county. And she did mention Paradise and the expansion into Fairview. And for those of you who are not familiar, Fairview is our alternative education school here in Chico Unified. And their school is smaller, but we know that they experience a significantly higher. I will just tell you, in the 5 years that we have been doing this, our referral rates have vacillated anywhere between 20 and 30%. And when I say a referral, that means that when our staff are with a young person and they are screening, the screening is 5 questions. And it's literally things like, can you tell me about your stress right now? How are things that are stressful in your life? You know, asking them about their peers and some of their substance use questions. And if anything gets flagged as maybe needing some additional support, that student gets referred to one of our staff, behavioral health staff, to do brief intervention. And a lot of the time, oftentimes students can identify their behavior. Brief intervention, if you're not familiar, is a process that's similar to motivational interviewing. And it helps the students to self-identify through interviewing problem behaviors and then create a solution as to how they're going to move forward in changing some of those behaviors. It happens more often than not that students can resolve within 2 or 3 sessions with our brief intervention specialists. That quantifies the first level of referral. Secondary level of referral is if we're like, oh man, this young person is going to need more support beyond what brief intervention is going to provide. And we have a clinician who is amazing, and she helps to support our young people who require more support than just brief intervention can provide. And so I will tell you some of the really great things about Physicians Committed is, one, we're kind of merging, there's very much this idea that physical health and mental health are separate when we know that they're very much intertwined, especially if you're familiar with ACEs. And so we are trying to help reduce that stigma and make sure that mental health gets considered as a piece of physical health. And we are also catching all of these young people who would not normally be screened for any kind of a mental health issue. And we know that about 50% of mental health issues start in adolescence. So now is the time when they need to be screened to help increase the effectiveness of prevention and early intervention. And then the other piece that's so great is that we're removing a lot of barriers for young people who would normally not have access to mental health services. They come into the program, they're like, oh my gosh, I don't want my parents to know about this. It's not okay culturally to be struggling with these things in my home, or it's not okay to be struggling with these things in my home. Having any kind of issue is not supported. And so having our clinician on board helps to mitigate them potentially activating their insurance or anything like that, where their parents might see that and get involved and have it be a red flag. So expansion is happening. We're having more and more people who are asking for this service to be provided, especially in light of all, as Danelle mentioned, just recurring crisis after crisis after crisis that has happened in our county. We're already a high need county with the highest ACE score in the state of California. And so the number of young people who need screening and need support is only continuing to increase. And the requests for service from our department have only increased over the last several years. So I think that that's probably most of what Danelle was going to share. Holly, can you think of anything else that I might have missed?
I don't think so. I want to say I'm looking at this amount and I don't think this is accurate for the new change request that's pending, because that's not how much the physician committed budget is each year. So more to come on that. This is really just the introductory phase of introducing this concept to the MHSA steering committee. And because of kind of the rapid expansion in the need that just kind of arose really recently, we don't have this included in our community input survey right now. So I really wanted to just start with going to the steering committee and kind of getting some recommendations or initial impressions or reactions about introducing this concept to our community. I know, oh, and one thing that Danelle was going to speak to, I'm sure of, is
Holly, I'm back on. I just didn't want to interrupt. Jen was doing such a great job that I just didn't want to interrupt her, but I'm on the phone now, so I've been listening.
I was just going to speak to the letters of support, Danelle, that you were generating. Do you want to touch on that briefly?
Oh, absolutely. So, in our coalition meetings, the Butte Now coalition meetings, we have been talking about the increased need and the expansion with the new medical providers, and really what all of the organizations that partner with us on the coalition are experiencing with the young people they're serving, and talking about this initiative potentially needing alternative funding sources in the near future, and our hopes for getting the extension approved. And several of our partners are really committed to helping make that happen, including the Butte Glen Medical Society, Chico Unified School District, Paradise Unified School District, Anthem Blue Cross, California Health and Wellness. I don't have it in front of me, Holly. I'm sure. Pleasant Valley High School.
We actually do have it in front of us, Danelle, because I put it into that document. So, so you're good.
Fantastic.
Yeah. So the committee might have noticed that I scrolled to the third page where we kind of have this matrix that explains the timeline a little bit better, and the stakeholder involvement. And then we do have a section here that says the MHSA steering committee reviewed this expansion and provided the following comments. So that's a lot of information, I know, for the committee to absorb right now. We probably would have started with the innovation subcommittee, but we've just really been challenged with our schedules to be able to meet. So that being said, does anybody have any initial thoughts or ideas on what they've just heard?
I do have a question. Initially, these kids were identified mainly through sports physicals. Is that correct? I guess.
Yes,
Okay.
back when it
And
was
so-
the pilot.
Right.
Mhm.
So I'm wondering now how are the referrals going to be made from the other various school districts and private physicians and all the others that are going to be included?
I don't know if we lost Danelle again, but I can help a little bit with that. So part of the model was that it would be incorporated with when students go in, when young people go in to see their pediatrician and they are in there for their annual physical anyway, that the mental health questions would be incorporated into that screening. And so that's how the referrals happen from physicians. And we have that infrastructure in place that our staff go out and they network with those physicians. And so if the physician has a referral, then they are referred back to our staff. They have a direct line to our staff and they make the referral and our staff make the warn handoff. As far as the districts, I apologize. I'm dropping my son off at school, so you may hear some car doors slamming. As far as other districts are concerned, there is a couple of things happening in the works as far as discussions. You know, they had talked about also incorporating it in athletic physicals, but also expanding beyond that, so that if there's a student that you know, one of the counselors is working with or somebody has a concern with, or they're also talking about expanding in other avenues. So the district is still working on, you know, how those referrals that would be made, but the physicians would be making those referrals directly to our staff. Does that help?
Yes, thank you.
Yeah.
For those kids who it's an issue to have issues, you know, with the family, when they're being screened at school, it seems like it stays pretty private, but I think a lot of times parents will go with their kids to doctor's appointments. Is there a way to, I'm just curious about how they're going to maneuver that privacy part of it if there's issues with being able to express one's issues at home.
So for youth who encounter issues with accessing treatment due to family conflicts, are there privacy considerations in place? Lori, is that?
Yeah, I'm just wondering if it just sounds like that it's not going to have the same level of privacy and willingness of the kids to express what they might not be able, you know, to express in front of their family members or.
Yeah, and I remember this being addressed when the entire project was initially put forward, that we heard that from the community. And so I know that they've incorporated those considerations into their program model. It has to do with adding that clinician who can serve kiddos who don't have Medi-Cal or try to get them connected to private providers, building rapport. This is just from what I remember. And I know Jen, I'm trying to help out Jen and Danelle because I think they're both trying to multitask a little bit here. That clinician would work to build rapport with the family and kind of say that was part of like their outreach and engagement with educating the family and normalizing the youth getting treatment. Another thing to consider is that for youth that do have Medi-Cal, if they are 12 or over, they can consent to services without the knowledge of a guardian. So that's only for Medi-Cal. That's not for other private insurance. But that's just another thing to consider.
Holly, I was going to hop in and say that exact thing, that once they're 12 and over, sorry, you were already saying that once they're 12 and over, I mean, just for myself as a parent, like my son is 8 and my daughter is 4, so I still go into their physical with them, but at some point I'm not going to do that anymore. Just because it's not necessarily appropriate. And so we have physicians that have said they would ask the parent to wait to, you know, protect the privacy of their young person during their physical. And we do the same thing, that we have had parents who try to accompany their young person at their athletic physical and like try to sit with the physician and try to sit with a screener while they're being screened. And when it's our staff, we ask that the parent wait separately to protect the privacy of their young person during the screening. And they don't always like it.
Right.
Yeah. Okay, thank you.
Of course.
Is there any
So
other?
in those I'm sorry. So in those cases where we're talking about private insurance, the parent can interfere and say, sorry, they don't have the right to request services if I don't authorize it.
Maybe I can help clarify that. So California state law allows for any clinician or provider, so myself, if I was in private practice, if I had a 12-year-old reach out to me, or someone who's 12 or older reach out to me and express that they had concerns, I have an obligation as a clinical provider to assess what their capacity is to provide minor consent for their services. This also includes, like, if you have a 16-year-old who becomes pregnant and can't tell her family, she's able to consent for perinatal services and go to an OBGYN and get medical care, right? What gets kind of tricky on the back end, which I think speaks to what Holly was mentioning with the innovation, is when you involve different payors for services, sometimes a bill will come to the parents for that service. And so you have to be really mindful of how you negotiate that as a provider to ensure that you retain that individual's confidentiality regardless of what their insurance status is. And I think it gets even trickier on the private insurance side, like Holly was talking about, with maintaining some of those boundaries and confidentiality, as opposed to what we can do on the Medi-Cal side within our system. So it's just kind of those nuances that are there in trying to ensure confidentiality and treatment for folks that are able to consent without their parents. Does that help?
Yeah, no, I was just wondering how we can get those kids included, you know, despite their familial situation.
Yeah, and I think like Jen Skinner and Danelle probably mentioned as well, and like Holly echoed, I think that's a huge piece of what they have incorporated in their program model, because they are capturing those kids that are navigating those situations within their family system, and they've already had them kind of pop up in their screening and referral process, and that's where I think their clinician has been significantly helpful in navigating some of those situations and relationships, which was part of the initial request to ensure there was no wrong door for those kiddos to get that brief intervention and screening.
Good. Okay.
Hopefully Danelle and Jen feel like I haven't misrepresented that.
No, I was just going to say, Jen, thank you very, very much. That's great.
And I'm back again. I hope you can hear me.
Yes, hi Danelle.
Hi. We're parked, so this should be stable.
Okay.
I was just going to add, I mean, aside from the barriers, I mean, unfortunately, no matter what system we put in place, we will always encounter barriers, whether it's parents wanting to sit in on the screenings or confidentially being able to access care. I think overall, this is a great project because it is going to capture a lot more of those kiddos who otherwise wouldn't be identified as needing that mental health support, one. And the second thing, I love that it blends the mental health and physical health, because Jen was absolutely right. We can't keep separating these out. It just creates more barriers and stigma around the mental health piece. So I love that it brings the mental health and physical health together. And I'm definitely in support of this because it's just another way to identify our young people who may not be identified otherwise.
Definitely.
Mm-hmm.
I agree 100%. And I think many of us, and Danelle knows this because she's awesome and we're like partnering all the time and no big deal, just saying. But this is going to be, we're in a mental health crisis, whether we see the fruits of it currently or not. And I think what we're in a position to do is, as a community, not as a particular system, that we really just have to get eyes on kids in a standardized, replicable, functional way. And for the first time, I think we have the ability to have consistent, reliable service. Not the first time, but we have consistent, reliable services on the back end that we've never had. And so, my view is we need to not get lost unless it's a legality in anything, but the more kids we can see, the better it's going to be for our community, especially around suicide prevention, which is our greatest fear currently. So, love it.
Yeah, absolutely.
Great. This is really great feedback. Thank you. Is there any other things that, if you don't want your comments included in this document, that's totally fine. If you just have a clarifying question, I just, for the sake of transparency, want to ensure that the state understands we've done our due diligence with reviewing this proposal.
No, I have no problem. My questions were to make sure that those kids that sometimes get left out, kind of like the plain vanilla kids, sometimes kind of get overlooked or they can sneak under the radar. And I just want to make sure that they get included too.
Mary, I'm sorry that I missed all of the discussion.
She's breaking up again.
That is such a good point. And I did forget to mention that Chico unified the 8th graders. And when that happens, that means
can't hear you.
Every 8th grader, just like the 10th grade hearing and vision screening being screened. You can't hear me?
You're just,
now we can.
This is so horrible.
Yeah.
Can you hear me?
Yeah. Maybe turn off your video, Danelle.
What I was saying was, yeah, I think you're right. Is that with the hearing and vision screenings, we do reach all 10th graders, and Chico Unified has asked that we expand that down to the 8th graders next year. So every 8th grader and every 10th grader, which I think speaks to your point, that then it becomes more universal because we're capturing all of the students in that grade level, not just those that are participating in a sport.
Okay, great. And even those, because you've got those quiet kids that don't necessarily make a lot of noise and trouble, but they've got a lot of deep-seated stuff, and so sometimes they're easy to ignore. But I'm glad to hear that all of the students are going to be screened. I think that's a great program.
Any other questions or comments?
The only question I had, I think if I recall, you said they would be covered in Orville and Gridley as well, but I didn't see any information on like the stakeholder involvement.
Yeah, I don't know if Danelle, if she's out of service or not to answer that question. I do know that they.
Sorry, January, can you repeat the question? You mentioned Orville and Gridley.
Yeah, there's a lot of conversation around Chico, and so I just am curious if Orville and Gridley are also included in getting support and services.
We're still working on it. This intervention was totally bred originally out of Butte Glen Medical Society and Chico Unified, and it has taken other school districts because we have to have the cooperation of the school district. We have physicians in Oroville who have taken this on, but we have not had, as far as I know, Danelle might know differently, but we have not had school districts in Oroville and Gridley come on board yet, though they have been approached. So it's still, and we know that they need significant levels of support. And so especially now that one of the school districts in Oroville is actually in trouble for some of the ways that they have been disciplining students. And so we know that they need additional levels of support, and have been trying to make connections with those school districts and have not always been able to do that. So it's a work in progress still, but not for lack of effort.
Well, I know we have data from Orville Unified.
Yeah, I was
They
just gonna
did
say,
one.
oh, go
They
ahead,
did
Jen.
one round of athletic physicals when they were doing sports, and now that that has not happened, there has not been anything else on that front.
Well, and Matt had put in the chat, can BCOE assist with the expansion? And I was thinking the same thing. You know, you have a number of BCOE people on here right now. So if there's ways we can support that, I think Matt and I would be happy to do that.
For sure. And
Or him, since he put it in the chat.
yeah, of course. And I know Danelle is well partnered with some of our BCOE partners. And so that's why I don't want to misspeak. There might be something that she has in the works that I'm not aware of. I'm just speaking to what I know currently.
I think like,
Yeah, and I think
So she might already. No, I was just going to say, so she might already be holding BCOE in her back pocket for something that I know about.
Well, I think that the reason I say that is I think, you know, we have a very good relationship right now, I think, with our districts. I don't think we've ever had a bad one, but it's been very, very close. And obviously those fire impacted communities, you know, we're with them all the time. Orville's tricky, as we all know right now, because of what they're being asked to do by the state, justifiably. However, these are things that can benefit that mission for them, and I think they know that. And I think so. So the reason I ask is because we tend to be around tables with those leaders a little bit more. And if we are able to go in and say, as part of our strategic plan around suicide prevention, and say, hey, then, you know, obviously there's no guarantees, but again, I look at all these, especially when we talk about expansion, and I think the days of us trying to do this alone, leading alone, we can't do it. And I think we've all recognized that. So a place like Gridley, we have a great relationship, but they're geographically different, right? So they're far. And so that's a tricky element, but they are struggling mightily, as we all are, with our concern about kids. So, you know, Danelle and I can talk about that, and Jen, maybe you and I can offline too with Sherry, and just see, let's make it, if all we can do is provide that link and that push and that justification, I think that has the potential to go pretty far. So just let us know.
Thank you so much. Yeah, and Oroville was really just starting to warm to the idea and piloted it with the athlete physicals. And then now that athletics is not happening, there has not been a subsequent venue to follow up. And, you know, there's potential for there with Gridley also to, you know, try and get that started with athlete physicals as well. So, because I know that some of those sports are in and practicing currently. So, so I think it's a great, I super appreciate all of the support, you guys. I know that BCOE has been just an incredible partner for us too, and there's definitely potential. So we appreciate the support for sure, and would love to connect more about that. I pulled over so that I would have good enough service that I could still.
This has been really great discussion. We have about 15 minutes left. Is there any other questions or comments?
I just want to say I super appreciate everybody's questions and support. It's been amazing to watch the journey of Physicians Committed, and to, I mean, I don't know that we ever really thought, I mean, the number of young people who are getting referred into services has been incredible. So it is definitely working very well.
Yeah, and I'm thinking that some of that data would probably support this proposal. We haven't even started to talk to the state yet. I mean, we kind of put it on their radar that this might be coming down, but the next step really would be for them to take a look and asked for if there's any supporting data or information related to outcomes that we can definitely infuse in there to make this proposal as palatable as possible. And then we would post for 30-day public comment period because this is it would be outside of our regular community input process that we're doing now. And so we would post it separately and promote that separately. Any other questions as I'm talking? I want to make sure we're covering everything. Great. Well, if there's no other comments or questions, if the committee wants to see a budget at our next meeting or any of those data outcomes, we're happy to put that together for the March meeting, if that is something the committee would be interested in.
I think that's a good idea. The more leverage we have, the better. And then at some point, do we have to submit a letter of recommendation or support or whatever? I certainly would be happy to engage in that as well.
Oh, that's great. That had never crossed my mind. That would be, I'm sure that would strengthen the case because we would be submitting other letters of support as well. So. Okay, well, thank you. I don't know if Danelle is still on. I think she might have had to drop off again. And thank you, Jen Skinner and Jen Stofa, for answering those questions. And I really appreciate the dialogue and conversation provided during our meeting just now. So I can continue with an innovation update, or I can bounce back up to community input. Does anyone have a preference?
I'd kind of like to hear about where we are in the community input process, if that's okay with everybody else.
Yep. Okay, so we have done officially 2 community input meetings. I'm getting ready to share my screen again because I would love for everybody to see what our website looks like right now. Okay, a new share, hold on. Okay. So this is when you go to buttecounty.net/behavioral health. At the very top right here, we've put a graphic announcing community planning process, and it's actually a direct link to our MHSA info page. So it says click here for more information. And then we have this announcement of community input is happening now. Here is a link that people can click to join a meeting during one of the specified times on the flyer. We have the flyer in Spanish and in Hmong. Thank you, Sang, for providing those translations for us in Hmong. We've had 2 meetings. The first meeting, we had 2 stakeholders. This last meeting, I believe we had 4 stakeholders. So we're really trying to generate the excitement around this, but it's also really hard during the pandemic to get people to come to these Zoom meetings if they've never, like, we're so used to Zoom now, but a lot of people, it can still be really intimidating. But we have released this information working in partnership with the Chico Enterprise Record that came out last week. This morning I did a radio spot for, I have to look at what the call sign is for that radio, but they're playing that tonight at 5 o'clock, a brief interview with me about why it's important to provide input, what this process is all about. And I'm really excited to announce and definitely want to give Rocio a big pat on the back and some applause for she translated the entire introduction to MHSA video and did the voiceover on it. It's really amazing. So everybody, if we could just give her a thumbs up or some encouragement. It was a huge undertaking and it's so exciting because we've never had a resource like this before. So I really want to give kudos to Rocio for doing that for us. And so we just loaded it to the website yesterday. So I'll send an email out announcing it either the end of this week or the beginning of next week. So we are getting favorable reviews about the video. People are finding it informational, helpful. We've gotten really good feedback on it. Some feedback we got was we should talk about the survey in the video, but I remember our intention as a steering committee was that this video would outlive the community input process. So we're really
That's
trying,
right.
yeah. So we're really trying to make it something we're going to leave up year round. And anytime anybody wants information on the MHSA, they can just go to this website right here. I believe last time I checked in with the MHSA analysts, we're at 40 something surveys. So on a really good year where we have really robust community input with no pandemic, we've gotten 200 surveys before. Last year, when the community input was interrupted by the pandemic, we had just over 100 surveys. So we're pretty excited about already having 40 something surveys with only 2 meetings down and 4 more to go. And so we'll continue to talk about the community input process and promoting it, and any help that any of you can provide with spreading the word, we'll happily take.
Holly,
Yes.
I just popped in. We have 67.
All right.
Gosh. So exciting. So if people can't join the Zoom meeting, they can watch the video and take the survey, which is located here in English and Spanish and Hmong as well. So that's really where we're at. We're going to probably, well, shouldn't say probably. We're going to conclude the community input process at the Behavioral Health Advisory Board on March 17th, where we'll show the video and ask attendees to take the survey. Then we'll close the survey no later than Friday of that week, which is March 19th. And so the analysts can start putting the feedback report together and then the steering committee can take a look at that at the April meeting, the steering committee's April meeting. Any questions about that?
Hey, I have a question, Holly.
Mm-hmm.
How do I get you on my radio show?
Oh, just tell me when and where.
Mondays between 10 and 11 on Mondays. If you're available on Mondays, I would love to have you on there. And we do broadcasting live on Facebook and Instagram as well. So I don't know if you're comfortable with that. We don't have to, but I would love to have you on the radio.
Yeah.
Just to talk about the surveys with our listeners.
I would love to do that. And, I mean, whether I'm comfortable with Facebook Live, it's kind of part of my job. So
it'll be fun.
Yeah.
You do great.
Sounds really good.
So I'll definitely reach out to you, Holly, so we can get that before the surveys end.
Yeah, on the 1st or the 8th, either one of those Mondays. I'm trying to take the 15th, the week that take that off.
I got you locked for the 8th. I'll send you an invite.
Perfect. That's exciting.
Thank you.
Awesome. Okay. All righty. Any other questions, comments about our community input and where we're at? Great, hearing none. We only have about 5 minutes left, but that's fine. Our innovation update, the rest of our innovation update is very brief. For the CARE project update, we did report at our previous meeting that the CARE project was undergoing the quality assurance review process, and I'm happy to report that they have cleared that process. All of the concerns have been resolved through the evidence that they have provided to the department. And so that was a really fun experience. And now we're moving on to looking at their change request and reviewing as an executive team. And we have a meeting set with a CARE project in the middle of March to discuss the change request further. For Everhart Village, we had our first technical assistance call with the Mental Health Services Oversight and Accountability Commission. And they gave us really a lot of feedback with meeting the regulations and things to consider as we build our project. And so we're very excited to have that support and guidance. And we're putting together a work group to meet every 2 weeks to really start working on getting that proposal defined and moving forward. So that's really where we're at with the Everhart Village update. Is there anything I am forgetting, Brenda or Rocio, about those 2 topics? Okay, Brenda's shaking her head. Okay. So that concludes our agenda for the day, other than talking about topics for the next meeting. Is there anything anyone is interested in seeing or revisiting? We talked a little bit about more details about physician committed, outcome data, and budget information. That's okay if nobody has any suggestions, because I can work with Mary in January closely to build the next month's agenda and to go over that.
I was going to say we could check in again about the surveys and the community input and stuff, because we should kind of have some preliminary stuff by then.
Yeah, yep. Our next meeting is March 25th.
Right.
So we'll have some, statistics on how many people took the survey and all that
Right.
stuff.
And Holly, one of my suggestions would be, it might be a good idea to kind of loop back around to like our vision and mission statement, just for new people who've joined. So just kind of like where we've been and kind of where we're at now would be helpful.
You honestly were reading my mind from earlier today. I was thinking we haven't looked at that stuff in a while, especially with the new 2 applications that we got for membership, and with Bobby and Sang being fairly new. We could revisit the guidelines for the steering committee and see if there's any updates that the committee wants to provide, because you guys are really in a body of your own that you defined your guidelines. So
right, we can make sure and extend an invitation to Anna too, so she could attend as well.
Yeah, great. Okay, well, that really concludes our meeting, unless anybody else has other topics that they want to explore or discuss.
Holly, I wanted to stay on and ask you a question.
Okay. Sounds good. Okay, everyone, thank you so much for spending your lunch hour with us. It's so nice to see everybody, and I'm going to figure out how I can get this video published for the people who did not make it today.
Okay. Stay healthy.
Yes.
Thank you, everyone.
Everybody take
Bye.
care.
Bye.